Can people afford to pay for healthcare in Europe? The short answer is not everyone. No country in Europe has achieved universal health coverage.
When people have to pay out of pocket for healthcare and they can't afford it, they either have to cut spending on other basic needs like food or heating, or they have to forego care and risk their health. Our new report on financial protection draws on evidence from 40 countries in Europe, including the whole of the European Union. It looks at the relationship between financial hardship, unmet need for healthcare, and coverage policy.
We measure financial hardship using two indicators: impoverishing health spending and catastrophic health spending. People face financial hardship due to out-of-pocket payments in every country in Europe. The incidence of impoverishing out-of-pocket payments ranges from under 1% of households in some European countries to almost 12% of households.
When we look at the countries, we see that catastrophic health spending affects between 2 to 20% of households, with a median value of 6%. But when we look at the poorest fifth of the population, we see that these numbers are much higher.
What is driving financial hardship in Europe? For people with low incomes, it's having to pay for outpatient medicines. For higher income households, it's dental care and medical products like hearing aids, things that poorer households can't even begin to pay for.
The numbers clearly show that health systems need to reduce their reliance on out-of-pocket payments. But how?
With the right analysis and political commitment, progress can be made.
To me, the greatest contribution of the report is that it tells the story behind the numbers, the policies that make a difference in terms of improving financial protection or making it worse. The report gives clear guidance as to what to do and what not to do to move towards UHC in countries.
Linking entitlement to payment of contribution causes gaps in coverage in countries with social health insurance schemes. The median share of households facing catastrophic health spending is 3 times higher in countries which exclude some groups of people than in countries which cover the whole population. Universal population coverage is a prerequisite for financial protection. Countries should leave no one behind.
User charges and co-payments are very widely used in Europe, particularly in the areas of primary care and within that around prescription medicines. We know that user charges put people off using dental care, and this not only leads to them having poor oral health, but also can have a very detrimental effect on their general health. We really should be moving towards a situation where access to health care is available on the basis of need rather than on the basis of the ability to pay.
We've identified the coverage policy choices that countries can make so that healthcare is more affordable, especially for people with low incomes or chronic conditions.
Don't link entitlement to payment of social health insurance contributions.
Don't exclude undocumented migrants from coverage.
Make sure that primary care treatment is part of the benefits package. Primary care includes outpatient medicines, medical products, and dental care.
Keep co-payments to a minimum.
If you have them, make sure they're really simple.
And that you have effective mechanisms in place to protect people.
Exempt people with low incomes or with chronic conditions from co-payments.
Apply an income-based cap to all co-payments.
Avoid percentage co-payments or replace them with low fixed co-payments.
Avoid balance billing and extra billing for medical services.
Remove administrative barriers.
Countries need to reduce their reliance on out-of-pocket payments. Our Barcelona office provides the evidence that they need to help them move closer towards universal health coverage.